Okay, so kidneys part two, polycystic kidney disease. It is inherited, a genetic mutation. It causes pus or fluid-filled cysts in the nephrons. The cysts compress the kidneys, causing vascular damage and scar tissue. As you can see, there's a lot of scar tissue and vascular damage in here. The cysts continually form. And so what happens over time is that with the cysts and the scar tissue, the kidney itself actually gets larger over time. Taking a look at this kidney, this is a nice healthy kidney over here. You could see how smooth and soft it is. So you can anticipate that urine would be able to be filtered properly through here. But as you can see with this, it's clear that it's kind of hard, stiff, compressed, and not much filtration, if at all any, would be able to occur with that particular kidney. So fluid will start to build up in the body because it can't get through this kidney. And then the healthy kidney actually has to work overtime to make up for the damaged kidney. When the kidney function is less effective, the blood flow to the kidney decreases. So, if the kidney it's still here, it's still part of the body, but if it's not registering that it's being perfused, then unfortunately, again, it can activate the RAS system. So that is no different than if we had low blood pressure. The RAS system would be activated. In this case, we're having low perfusion to the kidney, so the RAS system is also activated because it might think that we have low blood pressure. The problem here is that we already have hypertension, and the RAS system, which is trying to help perfuse the kidney, ultimately elevates blood pressure more, which is also then more damaging to both the cystic kidney as well as the healthy kidney. To treat this disease, we use pain medication, antihypertensives, diuretics, because we still have that good kidney, just to increase urinary output. Again, if they have urinary output, which they should if it's only affecting one kidney. And then the diseased kidney will ultimately need to be removed, especially if secondary problems start to occur from a buildup of fluid. So kidney stones. So there's many causes of kidney stones, otherwise known as nephrolithiasis. So the main causes are hyperuricemia, gout, and dehydration. Calcium is still the most common cause of kidney stones, but to determine the cause, a sample of the stone is needed to be analyzed. So depending on where the stones are lodged will determine the potential problems or damage that they inflict also. In order to analyze a stone, we have to put a sifter in the toilet to try and catch the stone so that they can analyze it. Now, if the stone lodges up here within the kidney, these are called calluses. If they're caught up in here, then it can cause some nephron or glomerular damage, right? Which in future can affect the filtration by causing some damage and some scar tissue. And so their kidney function in the future could be compromised. Now, if the kidney stops in the ureter, it can cause damage and scar tissue to the ureter itself, and we want these ureters to be really nice and free-flowing. We don't want any rough spots, because then that also increases the risk of solutes catching and causing stones. When we have the kidney stones here as well, it can back up into the kidney itself. The urine can back up, sorry, because the urine's coming down, but it can't go anywhere. And so this can cause hydronephritis. And then if the stone itself gets caught lower in the ureter, then it can also cause hydroureter, which is basically just a dilation of the kidney or a dilation of the ureter itself. And then that causes stretching and problems. So let's go to the next slide because it talks about hydronephrosis and hydroureter. So as you can see, if the stone gets blocked here, this kidney starts to swell and dilate with urine, the backup of urine. But if the stone stops closer to the bladder, lower in the ureter, then that urine will dilate the ureter as well. And this is all inflammation. As you could see, if we have this stasis of urine, infection can start to happen and cause, upper UTI problems or pyelonephritis. So what we do to treat these kidney stones, first of all, we try to have them pass their kidney stones, and there's some um, secondary ways that can help pass the kidney stones, just as you will learn in your med-surg class. But as far as medications are concerned, it's very painful, and so we want to give them pain medications to help with that pain control. We also want them to drink a lot of fluids, and we'll give them IV fluids as well, if not contraindicated, to flush the stone out. So if we've got lots of urine and lots of movement, then hopefully it'll help move that stone down um, to be removed through the urethra. We might want to give antibiotics prophylactically because of that stasis of urine and the high risk of causing an infection, which will then make the whole matter even worse. We can also give, if perchance it is hypercalcemia that's causing the calcium stones, because it is so prevalent that the stones themselves are calcium, some doctors will go ahead, if again not contraindicated, and give calcium channel blockers. That blocks the calcium and therefore helps prevent stone formation.